Hi, my name is Dr. Wendy. I am the naturopathic doctor here at HealthyToDos. Today with me, we have Elaine. She is graciously agreed to share her cancer experience with us. So, Elaine, thank you so much for agreeing to kind of share your experience.
You're welcome.
First of all, just share as much as you're comfortable with. Can you tell us a little bit about what you've been through?
Yeah, absolutely. So I was diagnosed with breast cancer, specifically triple negative breast cancer, which is very scary sounding and aggressive in the back in October. So when I first found out, it was caught early stage. However, the oncologist doctor said that it was a grade 3 aggressive triple negative tumor. It was definitely very alarming, and there were multiple tumors. But at this moment, at the time of filming, we are now in February. I've been going through chemo since November and now over 75% done chemotherapy. There will be surgery ahead of me, but seems like we're in a good path. So the last couple of months have been a little bit of a roller coaster,
Yeah.
but I'll say the most difficult part was the very beginning part where I had to wait for chemotherapy to start. And as soon as it started, pair with coming to see you, obviously, yeah, it's more manageable than I thought. And there are normal days to this, which I did not know that. Yeah, so I'm feeling very encouraged and excited to see the light of the end of the tunnel in a way. Yeah.
Of course. First of all, congratulations.
Thank you.
That's amazing that you've gone so far and you're so energetic. So, how do you feel like the naturopathic medicine has helped you in this journey?
Yeah, first of all, like seeing you, Dr. Randy, right away back in October and November before my chemotherapy had started was so incredibly helpful. That time, as I said, it was scary. I just was not know. I would not know what is coming ahead for me. I myself have never walked through any cancer journey with anyone before. So to have a chance to see you and you gave me such a thorough suggestion of dietary supplements that can keep company with this chemotherapy already eased my mind. So mentally, that was really important. And then as chemotherapy go on and revisiting the notes that you have given me and actually follow through in the ways that I can while seeing you every 2 weeks, I felt like it just like an extra insurance to go with the chemotherapy that is very specifically targeting cancer. I remember one thing you said to me, and you probably will say it better in our meeting is, it's like our body is a garden, you were saying, and the garden has weeds.
Yes.
And chemotherapy was kind of like targeting the problematic spot, while you and the naturopathic work is helping me with the overall soil and the foundation in the garden. And I've been taking it onto that. And now that I'm at this part, I really believe in it.
Okay.
Yeah.
That's amazing. And
Yeah.
I'm glad that you actually remember that. That is one of the things I always tell my cancer patients the role of naturopathic medicine in their oncology care because it's not like we're not a standalone. And we can also complement to make sure that your journey through this is much more functional, right? For lack of a better way.
Yeah, absolutely. And I have to say, like, in the beginning, when I got that big list of diets and supplements and all of those, I like
It's overwhelming.
it was overwhelming. And prior to getting my cancer diagnosis, I have been a very healthy person. I still think that I'm a very healthy person, to be honest. Like I got diagnosed at age 39. I felt like I'm the healthiest state of mind and mentally and physically. So I'm like, oh, I don't need that list of things. But during the chemo treatment, I was able to feel certain things and then go back to the list and able to find that solution to kind of give me that immediate relief. That was really helpful. And I now felt it. So I was telling you a little bit earlier off camera, for example, with the chemo drug that I have, I get neuropathy and also body aches. I'm a pianist, I'm a professional musician, That sensation terrifies me. I heard that neuropathy is not reversible. So the little sense of tingling is worrying me about my quality of life as a musician after this. But I was able to go back to your list, and you were telling me certain supplements that target neuropathy immediately, or like I don't know, it's immediately, but like directly.
Yeah.
And I just went out and make sure that like I'm diligently following it, and like it really helped make it subsided. Another thing that you always say is to take melatonin, and I know a lot of people worry about melatonin as a sleeping aid, but when you're hypersensitive with your body, at least with my experience during chemo, I can't sleep as well, and the melatonin actually give me deeper sleep, better, and I feel like I wake up more alert and ready to tackle not just the side effect, but the day as a normal human being, and not just like as a cancer patient. So I really am appreciative of that big list of supplements. Now I am. Back in October, I was scared of it.
Whoa, there's so much to do, right? But it is a life-changing journey in that sort of way. And I tell people that rather than focusing on the cancer, it's almost like a second chance that you can actually improve your body in a way that like your first try got you to cancer, your second try should prevent you from actually having that coming back. Right?
Yeah.
Okay. So I know that you're doing IV vitamin C.
Correct.
And for a lot of people who doesn't know this, IV is intravenous, so going to the veins directly. So you're doing a high dose vitamin C, and then you're also doing mistletoe therapy as an adjunct. So basically, mistletoe helps people improve their immune system, almost like a mild immunotherapy for people who are undergoing cancer treatment. So, in your experience, how has IV vitamin C and mistletoe helped your journey at this point?
Yeah, absolutely. There is direct help, but then there's also bigger picture help. So, first of all, I've been coming to you every 2 weeks because that is my chemo regimen. And usually the day before my chemo infusion, I will come for my vitamin C. It's a 3-hour process for me. And I'll say sometimes I come in feeling, I'm a little bit tired. We're doing this again. I drive for about 45 minutes to get here. But the crazy thing is, after vitamin C, I now have however many times I've done it, like over a half of a dozen times. Immediately, like that rest of the day, I felt so energized in the best possible way. It's really hard to describe. It's not like a caffeine kind of kick, but just like, oh, you're ready to go. And I was able to do so many things after vitamin C, whether it is work or rehearsals or attending. Like I went to a play last time when I came to you. Tonight I'm going to a Raptors game.
Had a pickleball game.
I had a pickleball game once. Went to the symphony orchestra. It's almost like Wednesday has become my day to get my vitamin C, and then I get to do like a really exciting social activity. And then the next day, I will have my chemotherapy treatment. So that vitamin C immediate effect is really exciting. But at the same time, in the long run, it's so important and helpful for me, not just physically but also mentally. So, this cancer journey could be lonely for some people. And for someone like myself, I am so extroverted. I need my social community. They are the people that lift me up. And I'm so grateful for that. And to have that vitamin C to allow me to work with accommodation and still see people, see my baby niece and nephew that I love so much. That boosts my mental health, and therefore my physical health just feels so much more supported. And then similarly with mistletoe therapy, it's something that I have to do the injection. And in the beginning, there were definitely doubts of, like, is this going to work? What is it? People hear the word mistletoe. Sometimes they might even get a little scared of it. But then it became something that I'm like, oh, it's the mistletoe therapy that is making sure that my immune system can handle like all the social gatherings, and of course I'm still safe. Like, I'm not sharing food with people, and I try to avoid hugs. But I work with choirs. Like my choirs have 100 people, and I want to be able to continue to have a rehearsal with them, not just for work reason, but fulfill my, like my soul as a musician, and to be able to have the energy to do that, and also feel safe to do that is truly an extra level of insurance and protection. And it's also have been kind of like a visible indication of showing how my body is going. So I don't know, is that affected to from the mistletoe, but last time the chemotherapy drug was actually giving me a delayed allergic reaction. And it was the mistletoe flare up that ended up showing me that, oh, your body is fighting something. And I didn't know that at that point, right? And then I talked to you and you're like, oh yeah, remember? Like I told you, like remember that is an indication? And I'm like, oh, and now I'm like extra aware and realize, oh, this is an indication. And going through the doses of it also give me a chance to see how my body is doing, reacting. Hopefully that means my cancer is going away as well. So yeah, like even though chemotherapy is almost done, like I'm done in 2 weeks, it's like, yay. I think I would definitely continue the vitamin C and especially mistletoe as best as I can after this. Triple negative breast cancer is scary to people because there are no extra medication that will help with recurrence. And recurrence rate of triple negative breast cancer is said to be high. So I think, even though the chemotherapy and seeing oncology just are done, I would love to continue to keep seeing a naturopath to continue with that in the next little while.
That's amazing. Thank you so much for sharing your
You're
journey,
so welcome.
Elaine.
Well, thank you so much for supporting my life and my cancer journey. I just feel so supported and loved by you, and you are so full of knowledge, especially specifically in my case with cancer patients. And that is something that I'm definitely, driving all the way to come see Dr. Wendy because like you have so much knowledge that support it. And that was apparent from our first consultation meeting. So like we are so grateful for you.
Thank you so much. All right. Thank you for tuning in, and we'll continue to kind of provide you with wonderful information. Just follow us on Healthy To Dos, and you can find me at info@healthytodos.com.